I believe you are all fine. I welcome you to my YouTube channel. This is JEMIENAFTALY and the channel's name is called The Pediatric World. And here we talk about, we learn on the common illnesses, common diseases that mostly affect children while growing up. And here we want to talk in a language that all people are able to understand. We want to be as layman as possible here. And the end result, we want to have healthy babies, and also we want to improve their quality of life. So then I welcome you back to this channel. If you're new here, I welcome you to this channel. So today's topic is a sensitive one. It's a very common topic, a common disease that we know. So we want to know more. And this is on the pneumonias in children. So pneumonia is a very serious disease, and we say it is a killer disease in under 5 years. So it is very serious. I will start by doing the definition. What is pneumonia? Pneumonia is the inflammation of the lung tissues, and this is by an infectious agent. And for example, we have like bacteria, or also viral, or even chemical irritants. So this will result to the damage of the lung tissue. So basically, it is the damage of the lung tissue. It is the inflammation. So this is what pneumonia is. The resolution or the recovery after the damage now, it may be partial or complete, meaning after the damage, the recovery the lungs may recover completely or even partially, depending. And also, let me say that clinical picture influencing pneumonia. The clinical picture of pneumonia is influenced by certain things. Number one, it is influenced by the age of the patient, meaning not all babies will not present the same. The ages, depending with the ages, it will be different. So like the newborns, the small babies will not present the same as the older babies. The clinical picture is also influenced by the nature of the infecting microorganism. For example, if it is bacterial or viral. Also, the clinical picture is also influenced by the presence of comorbidity. So when I say presence of comorbidity, I mean you have pneumonia, and on top of that, you have other pre-existing conditions. For example, you have, if there is HIV, then you get this pneumonia, or if there is malnutrition, for example. So this is what it's a pre-existing condition. So this is what we are saying, presence of comorbidities. What are the clinical features by the age groups? So number one, we are going to see in newborns. Newborns are those children that are less than 2 months. So how do they present when they have pneumonia? So we are saying that the symptoms are non-specific. We cannot say specific symptoms are for pneumonia here, because there are going to be generalized symptoms. So number one, they present with poor sucking. They also present with refusal to breastfeed. So if they feed poorly, and if or they refuse completely to breastfeed. So they also present with something we call lethargy. Lethargy is a weakness. It is a generalized body weakness. They are not strong enough. They are also going to present with hypotonia. Hypotonia is when the muscles, when we have low muscle tones. For example, you get hold of the arm of the baby. When you drop it, it just falls off. The tone is very low. They also present with apneic attacks. Remember the apneic attacks when you were talking about the low birth weight babies and the prematures. So apneic attacks are difficulties in breathing. They pause, like we said, somehow they forget to breathe. They have a prolonged pause in breathing, and then they start breathing. So this is what we are calling apneic attacks. They present with something we call head nodding. This is due to because of the difficulties in breathing. So they start nodding the head like this. So they have head nodding. They also present with grunting. Grunting is some sound that comes when they are breathing. This is what we are calling grunting. They also present with temperature instabilities, and they can have low temperatures, which we call hypothermia, or they can also have high temperatures, the fevers, what we call hypothermia. So they can have hypo or hypothermia. So they also present with abdominal distension. The abdomen becomes big and it is distended. We call it abdominal distension. They also present with tachypnea. What is tachypnea? Tachypnea is fast breathing. They breathe so fast, and the rate of breathing is so high. They normally have more than 60 beats per minute, very high. They present with severe lower chest wall indrawing. So lower chest wall indrawing is due to the difficulties again in breathing. So when you expose the chest of these newborns, you find when you inspect it, you find that there are the ribs draw some lines because they are really they are struggling to breathe. So this we call lower chest wall indrawing. They also mostly the cough is not there in newborns, and if it's there, it is very weak. The cough is weak. When you do physical exam, there's not much in these newborns, so mostly we get to know by the symptoms that we have just talked about. How about infants? Infants and the young children, these are now children that are above 2 months. So what are the clinical features of pneumonia in these children, the bigger ones, the infants? We are saying these that are above 2 months. So they again present with tachypnea, but their tachypnea, we said it is fast breathing. The respiratory rate here is more than 50 beats per minute. They also have something we call dyspnea. Dyspnea is difficulties in breathing. They also present with difficulties in breathing. They have something we call flaring of alanasi, still due to the difficulties in breathing. This is when they are breathing, you observe their noses, and there's this movement of the noses because they're really struggling to breathe. This is what we are calling flaring of alanasi. They have intercostal recession. When you expose again and you check the ribs, they are using other muscles to breathe. They want to compensate for this breathing. They use other muscles that are not supposed to be used while breathing. So this is what we are calling use of intercostal recession. The ribs just get inside and they use other muscles. They also have lower chest wall indrawing. We say they draw some lines when breathing because they are really struggling. They also have again head nodding. We say it this way when they are breathing again. These babies will present with fevers, high temperatures. They present with a cough. Also, we can have abdominal distension, and they also refuse to eat and drink. Again, they can present with wheezing. There is a sound again that you feel when the baby is breathing, so we call it wheezing. On examination, when you auscultation is when you listen the chest using a stethoscope. When you listen to the chest using a stethoscope, there are sounds that we call crackles, and these sounds are more of when you use, for example, a piece of metal on your hair. That sound that normally comes out, it is what you hear. These are what we are referring to as crackles, and this is when you auscultate, when you use the stethoscope to listen. So basically, these are now the clinical presentations in infants and young children. How about clinical presentation of pneumonias in older children, that is those above 5 years? These are bigger ones now. So number one, again, they present with fever, and the fever, the hotness of the body is quite high. It goes up to more than 39 degrees Celsius. So, the normal temperature, it shouldn't go beyond 37 degrees Celsius. So this one goes even beyond 39 degrees. They present with myalgia. Myalgia are painful muscles Every muscle of the body is painful. They also present with arthralgia. Arthralgia are joint pains. All joints become so painful. These big children also present with headaches. They also have cough, and sometimes it may be productive, meaning it produces sputum, it produces some mucus. It may be productive or not, but they have cough. They also have tachypnea again. We said this is fast breathing, and their fast breathing, their rate of breathing is usually more than 30 breaths per minute. They also have difficulties in breathing. These older babies can present with hemoptysis. Hemoptysis is coughing of blood. When they cough, they produce blood. This is what we call hemoptysis. And they have pain that radiates to the abdomen or to the tip of the shoulder. So basically, these are the clinical features in older children, and these we are saying in more than 5 years old. So this is what we have seen what pneumonia is. We have seen how serious it is, the clinical presentation by the ages. So this is it for today. It is going to be a wide one, because in our next episode, don't miss out, we are continuing, and we are going to do the classifications of pneumonia. We are going to classify pneumonia, so don't miss out. Thank you very much for listening to me. Again, I remind you, if you haven't subscribed, please hit on the subscription button, subscribe, like, share these videos so that they may reach many people. Also, leave a comment down in the comment section. Also, hit on the notification bell so that you are able to know whenever I post a new video. So thank you so much. Till next time.